Hello, I am Edward Premdas Pinto, faculty in the Azim Premji University. Today, some insights on our discussion on the significance of governance in urban healthcare. Urban India is growing rapidly. As we know, from 2011 to 2021, we have grown from 377 million to 594 million, and by 2036, as the National Population Commission says, about 39% of India's population will be living in urban spaces. The urbanization brings its own advantages and also challenges. One of the biggest challenges that we have faced in the urban is providing equitable and accessible healthcare, especially to the vulnerable communities. What is the significance of governance in providing accessible healthcare especially to the vulnerable communities? At Azim Premji University, we conducted a research and we took 4 representative urban spaces to understand the governance and its significance. We took Bengaluru to represent tier 1 city, Thiruvananthapuram and Raipur to represent tier 2 city, and Davangere, a district space in Karnataka state, to represent a district space. Our study found a significant relationship between the governance and providing accessible and equitable healthcare to people in these urban spaces. The research study provided us insights on the significance of governance. So, we found some 3 or 4 important factors. The first one is there is no uniform understanding about what is urban, there is no definition, and even what is considered urban completely changes day by day with the rapid urbanization and the swallowing in of the villages around the cities. So, the urban can represent a metropolitan city to a town panchayat and all the townships and cities in between. Secondly, what we found is the urban local bodies that were envisaged by the 74th amendment of the Constitution. They were supposed to play a significant role in the urban governance and providing health care, but we found in most of these cities that is not the case, and the urban local governance, and especially in their role in health, is yet to see the light of the day. Similarly, as at the turn of independent India, Bhore Committee provided a blueprint for the rural health services. But in the last 75 years of post-independence period, we have not found a policy impetus to streamline or to strengthen urban health care. And due to all these factors, what we find is that urban health system has grown in a haphazard manner. There is no coordination between the different governing bodies. There is no intersectoral, interministerial coordination between the government bodies themselves. And as a consequence of that is the accessibility to primary health care and equitable health care is a great challenge, especially to the marginalized communities in urban spaces. National Urban Health Mission that was launched in 2013 was supposed to plug some of these loopholes, and a blueprint was provided to make primary health care accessible to people especially to the vulnerable communities, and to have a good referral system for a secondary and tertiary healthcare services. However, even after about 8-9 years, the proposal has fallen between the cracks. That is due to the factors that are very significant, and policymakers need to give attention to these loopholes. Among them is the overlapping jurisdiction in urban spaces. For example, a number of gram panchayats and villages are engulfed by the urbanization process. However, they still continue to be under the Panchayat Raj department as gram panchayats continue, and the urban local bodies do not take adequate responsibility to providing health care there. This is the case of most of the cities, and in some cities like Delhi, there is a conflict between the urban local governance and the state jurisdictions themselves. And in most of the townships and cities, what we saw, there is an overlapping jurisdiction between the urban bodies such as corporations and municipalities and the state health departments, and they do not have a coordination among themselves. Now, these factors actually aggravate inaccessibility to the healthcare services. Hence, what we find is that even after 9 years of NUHM, it has still remained a distant dream, especially for the poor who were aspiring for an accessible healthcare service. Now, what does it mean, especially to the lives of the poor in the cities and urban spaces? Number one, many of these health services and facilities are not evenly distributed. They are far away from the locations of the urban poor, for example, the slums. And in turn, the poor then are forced to access private healthcare services. Private healthcare facilities in urban centers are neither streamlined, nor regulated, nor coordinated by the government, so that people can have access to these services. Hence, in emergencies and also in normal times, the poor are forced to access private healthcare, which is expensive, and the quality of care is not regulated. The sum effect of all this lack of governance, lack of coordination is that both accessibility of essential healthcare services, primary healthcare services and referral services and quality of care are compromised both in the private healthcare system and in the public healthcare system. The overall impact of such a lack of governance and coordination in urban health system has great implications to the lives of the poor. All of them in emergencies and in normal times are forced to access private health care, which is very expensive, and they shell out money from their precious earnings. According to National Sample Survey Organization's 75th round, the data shows that 30% of the poorest quintile are forced to access private health care, and this leaves gaping holes in their pockets. Now, all this research that we have done points to certain factors that the policy makers and lawmakers definitely should give attention to. The first point is that the budgets allocated for the urban healthcare services definitely has to increase. As we have seen in the national budget of 2022, the budget for healthcare itself has gone down, and this is a great challenge. Within the overall budget of the healthcare itself, urban healthcare gets a very minimal kind of attention. The second important point that research points to, which I think is very important for us to fix the holes in the urban healthcare governance. There are three important points that we would like to express. Number one, the urban health system requires a tremendous amount of coordination between various government bodies, especially the health and welfare departments, urban local bodies, other healthcare providers. It also requires streamlining, regulating and coordinating the private healthcare services. And thirdly, the budgetary allocations and the urban local bodies' role in providing health care to the poor has to tremendously increase. We hope that towards building a robust urban healthcare system, our report, Healthcare Equity in Urban India, will provide some valuable insights to the policy makers. We hope that it will also provide some inspiration and pointers to act upon to building this robust healthcare system. Thank you very much. Going forward, we do hope that this report can provide some insights for the policy makers to build a robust urban health system and to streamline governance. We do also hope that through this report and policy imperatives and implementation, the poor in the cities and urban spaces can have equitable and accessible primary health care, and that their lives can be better in the urban spaces. Thank you.